This is a presentation on traumatic brain injury in young children, brought to you by Vicki Schaefer for SPED 811, Characteristics of Early Childhood Special Education. Let's look first at the definition and causes of this disorder. Traumatic brain injury is a condition where an outside force of some kind has caused an internal brain damage. There are direct impact injuries, acceleration-deceleration injuries, and shockwave injuries. With acceleration-deceleration injury, the action is caused by bruising on the inside of the skull when the brain moves. Young children are especially at risk because not only do you have the initial damage, you can also have developmental issues as that child grows older. They may have delays and difficulties with their brain development. The number one causes of traumatic brain injury are child abuse, car accidents, birth trauma, and falls. Impacts. TBI has many impacts on a child's physiological and psychological state, as well as long-term educational and cognitive ability development. Some of the physical impacts: there are tiredness, aches, photophobia, dizziness, hearing impairment, speech dysfunction, vision impairment, sensory sensitivity or sensory loss, brain swelling, sometimes damage, seizures, weakness, numbness, loss of coordination, paralysis, coma sometimes, and death. Not all children who have traumatic brain injury have all of these, but any combination of these can occur. Psychological impacts. The psychological impacts from traumatic brain injury can include one or more of the following: confusion, frequent mood changes, depression, memory loss, impulse control issues, social dysfunction, impatience, inappropriate emotional response, personality change, post-traumatic stress disorder, obsessive-compulsive disorder, insomnia, irritability, nervousness, decreased motivation, aggression, ADHD, and oppositional defiant disorder. Educational and cognition deficits. Educational and cognition deficits experienced by students with TBI can include confusion, memory loss, short and long-term memory deficiencies, working memory problems, reading problems, symbol decoding difficulty, distractibility, inattention, social dysfunction, physical disorders affecting learning, reasoning issues, comprehension deficits, problems with self-expression, computation difficulties, problems with thinking processes, self-expression difficulties, and developmental delay. Interventions. TBI has a lot of problems with the first incidents, recovery from the incidents, and effects of the initial damage. So each child has to have an individualized plan of intervention and care. As the younger the child is, the more they stand to lose development in the milestones that are associated with age. So there is a greater risk for developmental delay. The goals of therapy for these children: there are restorative, remediative goals, which focus on retraining lost skills. There's habilitative, which focuses on new skill acquisition, especially with developmental milestones like learning to speak, learning to walk. Compensatory, which focuses on training adaptive skills for new needs. If the child, for instance, has lost the control of their legs, they need to learn new skills for mobility. If they've lost the ability to speak, they need to learn how to use assistive technology or other methods to communicate. And then there are functional goals, which focuses on basic life skills training, such as being able to swallow, being able to use the restroom, being able to provide self-care, even being able to eat sometimes is a functional goal depending on how profound the injury is to the brain. There are family-centered practices, specialist therapies, and educational interventions that are important with TBI. Family-centered practice is important because the child will have to be reintegrated with their family and home life with the possibility of new disabilities that their family has not had to deal with before. Often it's hard for the family to accept these changes. They don't understand that their child may never recover, or that their child may act like a totally different person. So it is important to provide therapy for these families. They also have to make adjustments for the child's new needs and abilities. These are very big impacts on home life, and usually are something that parents and family members have never considered having to accommodate for. Families need to be educated on TBI, they need to be trained on how to care for the child, and they need counseling to be able to cope with these new needs. Specialist therapy. Specialist therapies fall into the categories of physical, psychological, and developmental skill therapy. With physical skills, they need functional skills such as self-feeding, swallowing, different activities that require muscular control. They often require movement therapy. Depending on the area of the damage to the brain and its extent, they may have profound movement paralysis issues, or they may have a slower gait, an awkward gait. They may not be able to use their hands. So this is what physical therapy focuses on. Psychological therapy involves counseling, behavioral control, and social skills retraining. These are meant to help the student adapt to the new limitations on their life, as well as understand what's happening to them and cope with those things. Also, to be able to take things back into their own control as much as is possible. Developmental therapy focuses on retraining or developing cognitive skills, communication skills that may have been lost, and focus. Very often, communication is harmed by the inability to speak, the inability to understand communication, the inability to comprehend the symbols that we use for reading or doing math. So these are ongoing developmental skills that have to be monitored and trained. Focus especially is both a physical and cognitive skill that has to be retrained based on muscular movement and the ability to eliminate background distractions. Educational interventions are extensive because TBI affects all aspects of a child's education. Very often, students with TBI have issues that need intervention from either a 504 or an individualized education plan through special education. Especially IEP is very valuable because it allows instructors for the child's growth to be monitored and planned on a continuous basis. There are generally a need for positive behavior supports because the student may have lost the ability to control their behavior. There's a lot of emotional changes, a lot of impulse control issues that have to be supported through positive behavior supports. Advanced transition plans, since a child can often suffer from delayed development or have problems anticipating transitions even on a daily basis, there needs to be plans in place for both small transitions on an hour-by-hour basis and life transitions. They need to receive individualized therapy, often speech therapy, cognition therapy, hearing therapy. There are all kinds of therapies that are available through the school system once a child has qualified for special education services. Students with TBI need to have a structured environment. Things need to happen on a regular basis. They need to have a quiet environment. The more structure that is involved, the better the student's chance of being able to cope with the daily changes and adapt to their new life with a TBI. Accommodations and modifications, those are classroom educational adaptations, like having a reader if the child cannot read, having a para there to support them when they have educational needs, sometimes to shorten assignments, to break those things down into smaller steps so that the student can comprehend them better. They also generally have a need for assistive devices that can be anything from reminding them of assignments that are due at the time of the day, allowing them to communicate if they have lost that ability vocally. There are all kinds of assistive devices that may need to be incorporated in the classroom. One of the biggest things are specialized teaching strategies. Teachers who are teaching a student with a TBI need to state their goals clearly for what's happening. They need to explain the relevance of what is being learned, because if the student doesn't understand why they're learning something, they're going to have more difficulties struggling through it and seeing the point. Teachers need to give clear, simple instructions. They need to use precision commands, which is a way of telling a student what to do that's in a positive way rather than a negative way. Generally by telling them the positive thing to do, such as, please listen to me right now, rather than be quiet. They need to use low voice and use proximity, such as going up to a student and looking at them directly to give them instruction. They need to use small steps and demonstrate those steps repeatedly when they're giving instruction. They need to take the class at a slower pace. They need to allow the student more time for response, and they need to have a lot of breaks in the classroom. They need to give these students immediate feedback with error correction on work that they are doing, and they need to use praise and encouragement as well to balance out that negative feedback with positive feedback, so that the student understands that they are making progress and it's good progress, but they need to make changes. Here are the references. There were several very good references. One of the best that I saw for parents was this one by Howard, Fry Williams, Miller, and Aiken, which clearly stated the kinds of things that all levels, educators, families, and service providers needed to know about the condition. Another was through the Mayo Clinic. But there were several sources at the Mayo Clinic that had good information. Even this one from Dolman Law was very clear and easy to understand, and also could help parents identify if their child had a traumatic brain injury. Thank you for listening to my presentation.